Tina Varona. Thank you so much for joining us for this live Facebook discussion. Well, the immune system plays a significant role in multiple sclerosis therapy. Advanced treatments using neuroimmunology are led by a comprehensive team at the Hartford Healthcare IR Neuroscience Institute. And part of that team is physician assistant Rachel Duke. Rachel, so nice to see you.
Thank you. It's good to be here. Thank you for having me.
Absolutely. Well, the interaction of the body's different systems can be quite complex. Tell us how you use the nervous system and the immune system to treat patients.
Multiple sclerosis is a complex disease that involves the immune system and the nervous system. And in MS, the nervous system gets overactivated or stimulated and begins to attack the tissue and cells of the central nervous system. And so that is the medications that we use and the treatments that we use often focus on the immune system and modifying the immune system in such a way that it should not attack or cause that damage. And so we use medications. We also use physical therapy, other medications for symptom management to treat both of those things, both of those sides of the disease.
And it takes a comprehensive team, to have these treatments in place. Every patient is different, and you have to really come up with a real good, solid treatment plan to treat patients through immunology. Explain how that process works.
Right. So our team here consists of Dr. Wong and myself in Southington and Dr. Derek Smith out in Norwich. And we all have special training in multiple sclerosis so that we can understand the way these medications work and the way that the immune system interacts with the nervous system. We also have a great team of physical therapists who are spread all across the state who work to treat and target these things to provide treatment.
And this has made a remarkable difference in the lives of multiple sclerosis patients. Tell us about some of the stories and the outcomes that you've seen in your patients.
Yeah, so we have seen a great abundance of medications being approved for MS over the last several years. And luckily, we are able to access some of the most cutting-edge treatments here, some of the newest treatments. And we have seen patients go from being severely disabled, without treatment years and years ago, to being able to treat patients now in such a way that their disability is kept at a minimum. And we see patients now who are able to continue working, live their lives the way they want to live them without allowing MS to own them.
It's really remarkable, and it also, some of these drugs and these treatments that are available now are prolonging the advancement or keeping this disease at bay for a lot of patients. Is that correct?
Correct, yes. We have some very effective treatments that are able to greatly reduce the disability. MS is a chronic progressive disease, and so unfortunately we do not have a cure yet.
Mm-hmm.
But many of the treatments that we have can greatly slow the disease and keep the disability as slow down as we can make it.
And now tell us about the treatment itself. When a patient comes in for this type of therapy, what can the patient expect, and how long do they need to come in? How does this last? How does the treatment plan work?
Right. So we have a variety of treatments available. We can really tailor it towards what's best for the patient and their particular disease. No MS patient is the same, and no MS patient has the same treatment course and the same symptoms and presentation. And so we take all of that in consideration, as well as each patient's individual risk factors when we consider a disease-modifying therapy. There's over 20 disease-modifying therapies approved for multiple sclerosis now. Some of these are injectable medications that a patient would inject themselves, maybe a few times a week. Others are pills, so oral pills you take once or twice a day. Some are pills you even just take once a year. And then there are infusion medications, and the infusion medications may be given once a month or once every few months.
It's pretty incredible when you think of, and not many people think of the immune system in playing such a pivotal role in someone with multiple sclerosis and even cancer patients. The immune system is just really almost the catalyst for, for these diseases to really sort of ramp up. These medications, a lot of new medications on the market and more to come. It's really incredible how you can take that and sort of regain control against the immune system in terms of blocking it from advancing these diseases, correct?
Yes, it is amazing how far we've come. We definitely target, each of these treatments target different parts of the immune system that we know play a role in MS. They play a pivotal role, and so we're really able to target these things specifically now, whereas we weren't just 20 or 30 years ago.
Yeah, we've certainly made leaps and bounds. Malik on Facebook says, thanks for this great information. Malik, thanks so much for watching. If you have a question, Rachel is here. We're happy to answer your questions as well. Rachel, we have come a long way in terms of multiple sclerosis and patients being able to live active, healthy lifestyles through these types of treatments.
Yes, we have. I had a patient once who was a marathon runner prior to getting MS. And he, we worked with him on his treatment, and luckily we were able to keep his treatment tailored towards his lifestyle, and he did not have a lot of side effects in the treatment. He tolerated it well, and his MS responded really well to treatment. And he was able to continue running marathons even after having MS for several years. It really is amazing what we can do.
Yeah, it absolutely really is. How long do the treatments last for someone undergoing immunotherapy?
Right. So it depends on which treatment that you're on. Disease-modifying therapy is a lifelong therapy, so you do have to be on some kind of treatment for the majority of your life after being diagnosed with multiple sclerosis. Unfortunately, we don't have a cure or a way to completely stop or get rid of multiple sclerosis. And so our focus is on delaying disease activity, preventing new lesions, new activity on the MRIs, both the brain and the spinal cord, as well as focusing on symptomatic management. So most people take a disease-modifying therapy for many years, 10, 20, 30 years of their life, depending on when they're diagnosed. Every now and then, as someone gets older, we're able to take them off their treatment, but for most people, they continue some sort of treatment for the majority of their life. And that might be a daily pill. It may be an injectable you do a few times a week. It might be an infusion you get. Some of the newer infusions are even less frequent, every 6 months or even once a year.
And how do patients respond to that after their treatment? What do they say to you?
Most of them really are impressed with the treatments that we have, and they tolerate them really well. Nobody wants to be reminded that they have MS every day, and so to be able to feel good and feel like yourself is so important. And I think most people do really well with the treatment. Every now and then you may have a side effect or a problem with a treatment, but we have over 20 treatments available now. And so we're usually able to find something that will work for you long term.
It really is incredible. And I think that speaks to the comprehensiveness of the program because there are so many medications and treatments available. I think it's important to mention that, every patient is different. One medication may not work for one patient, but it might work for the other patient. So I think that's where the experience really comes into play at the Eye Neuroscience Institute. Talk to us a little bit about that and how you approach each patient's case.
Right. So there are certain risk factors that you might have that would make you more likely to have an aggressive disease course. Those risk factors are often related to things you can't always change. We know that men are more likely to have an aggressive course of MS. African Americans are more likely to have an aggressive course. People who have low vitamin D deficiency, people who smoked, people who have disease that involves the spinal cord as well as the brain. And so we take those into consideration, and we tailor that when we pick out a treatment that is going to be effective for you while providing the lowest risk that we can provide to you as well, the lowest risk of side effects and bad reactions. We also take into consideration your lifestyle. Are you someone who can take a pill every day? Do you mind taking a pill every day, or are you somebody that's going to tell me you forget to take pills often? If that's the case, then we have treatments that you don't have to take every day. You can come every 6 months and get an infusion if you're a candidate for that medication.
Yeah, highly specialized care. Rachel, what are you seeing in terms of trends and multiple sclerosis and where we are now? Are you seeing any trends out there with younger people? You mentioned males are more apt to get multiple sclerosis, but are there any trends out there that you're seeing?
Yeah, so it's actually males aren't more likely to get multiple sclerosis, but when they get it, it's more severe in them.
Mm-hmm.
Multiple sclerosis is actually a lot more common in females,
Mm-hmm.
a 2 to 3 times higher rate in females, and that's actually increasing. It does affect women more than men. You know, it's always been more common in people who are younger. Autoimmune disease in general is more common in people who are a younger age. So I guess what we're seeing is that we're able to diagnose it earlier.
Mm-hmm.
We're getting better at diagnosing it. We know what to look for now. We have better tools, better MRI machines. Here at Harvard Healthcare, we have several 3T MRI machines, which are really strong, good magnets that help us see and get the best picture we can get and help us diagnose people sooner. So our tools are getting better, and so we are seeing more younger people who have it, but it might be because we are getting better at detecting it earlier rather than it's actually affecting people younger than it used to.
Do we know, very interesting by the way, do we know why more women get multiple sclerosis?
So we know that autoimmune disease is more common in women, so that might be why that is. I don't know if we really know why autoimmune disease is more common in women than men.
Mm-hmm.
There's a lot of theories out there, but just autoimmune disease in general, including multiple sclerosis, is more common in women.
So what do you say to patients out there with MS that are maybe newly diagnosed and with all of these, may not be aware of all of these treatment options available or anything about neuroimmunology? What do you say to a patient that's been newly diagnosed?
Right. I always tell patients that we have a lot of options now.
Mm-hmm.
You may know somebody who has MS and think of them as being somebody who's severely disabled in a wheelchair. And 30, 40, 50 years ago, that may have been the case. But now we have so many treatments. It's not the same as it used to be. You don't have to be disabled because you have it. You can go on living your life the way you want to live it. You need to make some accommodations to accommodate for treatment. You need to know your limitations, but at the same time, it's not a life sentence. It's not the end of your life. It's just an adjustment, a change to your lifestyle.
Absolutely. It's certainly a tough diagnosis to hear, but there's so much hope out there and so much promise and neuroimmunology, and we've made such great strides and incredible advancements in this area. So Rachel, I want to thank you for all of the work you and your team do at the Ira Neuroscience Institute in helping patients get back to living their healthy lives and their normal lives again. So we thank you.
Thank you. Yes.
And if you'd like more information, just simply log on to hartfordhealthcare.org/MS. I'm Hartford Healthcare's Tina Varona. Thank you so much for watching. We'll see you again real soon, but for now, be well.